Naloxone is a medication which is the antidote to opioid overdose. Opioids that can cause overdose include heroin, methadone, morphine, and fentanyl. When someone has an overdose, the way the brain controls breathing is affected. This means that sometimes a person can stop breathing. Naloxone works by quickly reversing this. This video will teach you how to recognise and manage an opioid overdose, including how to administer naloxone. While what we discuss is relevant for all opioids, the opioid that most commonly causes overdose is heroin. So throughout this video, we will refer to heroin. If you think someone has taken an overdose, you can follow a few simple steps that could save a life. A. Call the ambulance. B. Check the person's breathing. C. Put the person into the recovery position. And if you have it, give naloxone. Before we look at this in more detail, it's important to know the risk factors for overdose. These include injecting heroin, using heroin with other drugs or alcohol, using heroin by yourself, using heroin after a period of not using, for example after a detox program or after release from prison, and taking larger than usual doses of heroin. If you or anyone you know is using opioids in these situations, you're at a high risk of having an overdose. There are many signs that may indicate someone has had an overdose, such as if the person is unresponsive or has lost consciousness, slow or shallow breathing, blue lips and skin, very small pupils, and deep snoring. If you think someone has had an overdose, you can follow some simple steps that could save a life. But before doing this, you need to make sure you are not in any danger. Check for any needles on the floor or in the person. Check if the person is responsive by calling their name loudly.
Ange, can you hear me?
Shake the person.
Ange!
And rub sharply on their chest plate.
Ange, can you hear me? Can you feel this?
Remember, ABC naloxone.
Hi, I'm with my friend and I think she's had a heroin overdose. Yeah, we're at 30 Davis Street. I've got some naloxone on me. Okay, I'll stay with her. See you soon.
B is for breathing. There are a number of ways you can check to see if someone is responsive and still breathing. Look to see if their chest is rising and falling. Listen to see if you can hear them breathing. Put your hand in front of their mouth to see if you can feel them breathing. C is for the recovery position. Make sure the person is lying on their back and kneel at their side. Bend the elbow closest to you into a right angle with their palm facing up. Take their other arm and fold it so that the back of their hand is below the cheek closest to you. Bend up the person's knee that is furthest from you. Pull the knee to roll the person onto their side. Open their airway by tilting their head back and lifting their chin, and check that nothing is blocking their airway. Now, if you have any, you can give the person the naloxone. Naloxone works very quickly and only takes a few minutes to have an effect once you administer it. Naloxone comes as both an injection and as a nasal spray, and the way you administer it depends on which form you have. This video will teach you how to use both forms, starting with the injection. We are going to use the devices most commonly available in the UK. If your device looks different to the ones used in this video, it is important that you read the instructions carefully for your device and ask a worker at your local drug and alcohol service. First, crack open the box by twisting it. Remove the rubber cap from the end of the syringe. Open the needle pack and put the needle onto the end of the syringe. The best place to administer naloxone is into a big muscle, for example the outside of the thigh or upper arm. Give 1/5 of the naloxone syringe and wait 2 to 3 minutes to see if they respond. After you have given the injection, put the needle somewhere safe and give it to the paramedics when they arrive. If you have a nasal spray, lie the person on their back with their head tilted back. Place your index finger on either side of the nozzle with your thumb on the plunger. Place the nozzle fully into one of the person's nostrils so your index fingers are against their nose and press the plunger fully to give the naloxone. Once you have given naloxone, the person should start coming round after 2 to 3 minutes. If they are still unresponsive or their breathing has not returned to normal, you need to give a second dose. If you're using the nasal spray, give the second dose of naloxone in the opposite nostril. If the person is not breathing and you are trained in CPR, you can commence it now. Sometimes when you give someone naloxone, the person can start having withdrawal symptoms. They may become aggressive and agitated. It is important that you stay with the person until the ambulance arrives, if it is safe to do so. The effects of naloxone last about 30 to 90 minutes, which is shorter than the effects of heroin. This means that once the naloxone wears off, there is a small chance the person can go back into overdose. Stay with the person until the ambulance arrives. It is important that the person does not use any more drugs or drink any alcohol. If you need more information, contact your local drug and alcohol service, pharmacy, or GP. So remember, if you think someone has had an opioid overdose, A. Call the ambulance, B. Check their breathing, C. Put the person into the recovery position, and then give naloxone. This could save a life.